morning again, everyone, and happy Sunday. So today is part 2 of lung cancer. And let me pull my screen up so I can share with you. Okay, so last week we went over what is lung cancer, we went over the signs and symptoms, we went over risk factors. So I want you to keep in mind that lung cancer is a malignant tumor that starts in the lungs, usually in the cells that line the air passages. It is the most common cancer in men and the second most common cancer in women. It is believed to be the leading cause of death in both. The survival rate is based on the stage of the disease. So now you hear all these symptoms that I've spoken to you about, and now you want to make an appointment to go to your doctor. Because appointments can be brief and because there's often a lot to discuss, it is a good idea to be well prepared. To help you get ready, try to be aware of any pre-appointment restrictions. At the time you make the appointment, be sure to ask if there's anything you need to do in advance, such as restrict your diet. You want to write down any symptoms you're experiencing. And that goes for any time you're sick and you're getting ready to go to the doctor. You want to write down any symptoms you're experiencing, including any that may seem unrelated to the reason for which you scheduled the appointment. Note when your symptoms began. Write down key personal information, including major stresses or recent life changes. Medication lists that includes your vitamin supplements that you're taking. Gather any medical records that you may have or have had from previous doctors that you may want to have taken to this particular doctor. Consider taking a family member or friend along. Sometimes it can be difficult to remember all information provided during an appointment. And I want to touch on this a little bit and give something personal. My mom, I remember when she was diagnosed with cancer. And it's a good thing I went with her because once the doctor said the word cancer, I saw when her face completely shut down. So she was no longer listening to anything that was being said. And so I had to be the one that was writing things down to talk to her about it once she got home. Okay. So you want to write down any questions you want to ask the doctor. So what do you expect when you get to this doctor? The doctor's likely to ask you a number of questions. Being ready to answer them may allow you more time later to cover other points you want to address. So the doctor may ask you, when did you first began experiencing the symptoms, right? Have your symptoms been continuous, occasional? How severe are these symptoms? Do you have problems breathing? Are you doing anything that causes you to have problems breathing? Do anything for it to actually stop? You want to go over your medications. What, if anything, seems to improve your symptoms or even make your symptoms worse? So those are some basic questions that the doctors may ask. And so that's why you want to make sure that you're ready to talk to the doctor. So let's talk about the types of lung cancers because there are different types. Doctors divide lung cancer into 2 major types based on the appearance of lung cancer cells under the microscope. The doctor makes treatment decisions based on which major type of lung cancer the individual may have. There are 2 general types of lung cancer. One is called small cell lung cancer, and the other one is called non-small cell lung cancer. So what are the treatments? The individual and the doctor choose a cancer treatment plan based on a number of factors, such as their overall health, the type and stage of the cancer, and the individual preferences. This includes chemo, radiation, targeted drug therapy, immunotherapy, palliative care, surgery. And during surgery, the surgeon works to remove the lung cancer and a margin of healthy tissue. So they may do what's called a wedge resection, segmental resection, lobectomy, pneumonectomy. So they take off parts of the lungs, or if not, the entire lung comes out. So what are the complications of lung cancer? Because people have lung cancer, some people don't want to go to get it checked, they don't want to get it treated. So some of the complications include shortness of breath, coughing up blood. It's not always lung cancer if you're coughing up blood. Let's be clear, because sometimes you can cough so much that you irritate the lining of your lungs and you start to bring up some blood. That can be that as well, okay? Sometimes because your passage is actually dry and you can also bring up blood. So don't, because say, oh, I've been coughing up blood, maybe I have lung cancer. Please don't do that, okay? Advanced lung cancer that spreads to the lining of a lung or to another area of the body, such as the bone, can cause a lot of pain. The person may have fluid in the chest, what's called pleural effusion. And then they have cancer that spreads to other parts of the body, which is called metastasis, meaning it metastasizes throughout the whole body. Once lung cancer has spread beyond the lungs, it's generally not curable. Treatments are available to decrease the symptoms to help the individual live longer. So the percentage of new cancer cases and cancer deaths worldwide, you have 11.6 of new cases for lung cancer alone. Colorectal is like 10.2. So lung cancer is pretty much up there. Lung cancer and breast is actually neck to neck, okay? So this is some other statistics. It is estimated that nearly 234,580 individuals in America alone will be diagnosed with lung cancer. And worldwide, it is even higher. This is just some more. Lung cancer kills, they believe, at least 167 women every day, because a lot of women have now gotten into the habit of smoking and all that. So this part I want to touch on because it involves the young adults. A lot of young kids nowadays, you see them want to smoke and all that. Be mindful of the things that you're doing, the vaping and all those things. And what's happening is that the young patients are often diagnosed but when this disease is already advanced, because they don't usually say what's wrong. They assume it's just something minor and say nothing. And so they don't get themselves checked out. And by the time they are checked out, it is advanced. So secondhand smoking and smoking yourselves, if you're doing that, I would implore you to stop. Females, new cases, 116,660. Risk factors, 1.17, and the death rates are high, and the men are right neck and neck with them as well. In Jamaica, lung cancers, according to the latest World Health Organization data published in 2020, lung cancer deaths in Jamaica reached 472, or 2.70% total deaths. In Jamaica, lung cancer remains a significant health concern. Though its prevalence is comparatively lower than in North America, the limited awareness, the stigma surrounding smoking, and challenges in accessing advanced diagnostics and treatments make early detection and prevention essential. And we know that there's a lot of people that go through a lot when it comes to getting their diagnostics in the islands. And so we're hoping and praying that you'll have more advanced and have the equipment that is needed for you to have these tests done and be diagnosed in a decent time and be treated. So how do you reduce your risk of lung cancer? Don't smoke. If you've never smoked, don't start now. Talk to your children about not smoking so that they can understand how to avoid this major risk factor of lung cancer. Begin conversations about the dangers of smoking with your children early so they know how to react to peer pressure. If you're smoking, stop smoking. Stop smoking now. Quitting reduces your risk of lung cancer. Even if you've smoked for years, you want to talk to your doctor about strategies to stop smoking, aids that can help you to quit, because there are aids that have to actually help you. Options include the nicotine patch. They have medications as well as support groups. Avoid secondhand smoking as much as possible. If you live or work with a smoker, urge him or her to quit. At the very least, ask him or her to smoke outside. Avoid areas where people smoke, such as bars, restaurants, and seek out smoke-free options. Other ways to reduce your risk: test your home for radon. We spoke about this last week. This is the testing kit that you can also get it on Amazon in any hardware store. You want to avoid carcinogens at work, so you want to take the precautions to protect yourself from exposure of toxic chemicals at your workplace. Every workplace should have an area where you can speak to someone to get whatever protective equipment you need to keep yourself safe. Eat a diet full of fruits and vegetables. Choose a healthy diet with a variety of fruits and vegetables. Food sources of vitamins and nutrients are best. Avoid taking large doses of vitamins in pill forms, as they may sometimes can be harmful. So I like a lot of liquid vitamins. I take a lot of liquid, but I do take my vitamins and I spread them out. Okay. For instance, researchers hoping to reduce the risk of lung cancer in heavy smokers gave them beta carotene is actually a good vitamin to take as well. Okay. Exercise most of the days of the week. Now notice I say most of the days. We had an exercise challenge going on for a while. We somehow fell off. So exercise most of the days. If you can do at least 30 minutes a day, that is great for you. And research has shown a better health outcome for many people who actually do that. So factors that influence lung cancer, again, age. People over age 70 often have weaker immune system. So, want to avoid them being around people that are secondhand smoking or they themselves smoking, okay? Coping. A diagnosis of cancer can be overwhelming, whether it's lung cancer or any form of cancer or sometimes any illness, okay? With time, you'll find ways to cope with the distress and uncertainty of the cancer. Until then, you may find it helps to learn enough about the lung cancer to make decisions about your care. Ask your doctor about your lung cancer, including your treatment options, and if you like, your prognosis. As you learn more about lung cancer, you may become more confident in making treatment decisions. Keep friends and your family close. It's not the time to push individuals and your loved ones away. You want to have as much support as you need, okay? Find someone to talk to. Find a good listener who's willing to listen to you, talk about your hopes and fears. This may be a friend or family member, maybe your clergy, your pastors, assistant pastors, a member of the church. The concern and understanding of a counselor, medical social worker, clergy member, or cancer support group also may be helpful. Ask your doctor about support groups in your area, or check with your local and national cancer organizations, such as the National Cancer Institute or the American Cancer Society. I want to give special acknowledgement to the Mayo Clinic, the American Cancer Society, Knight Cancer Institute, Lung Cancer Research Foundation, World Health Organization, Verywell Health, Canada.org, and World Cancer Research International for the information that I provided you today. I hope this was helpful. I implore you that if you did not get the full information on this segment, to go back to my YouTube channel and watch it. It is full of a lot of information that can be helpful, and I want you to take very good care of yourself. God bless and enjoy the rest of the service.